È stato per noi un onore e un piacere avere questo saluto che ha aperto il pomeriggio su un tema che è proprio connesso a quello del dominio che andiamo a trattare. Ora tornerò all'inglese. So, thank you for the intervention and being honored to have you here and to open properly the track that is dealing with nature-based solution also. So I will give back the floor to Dr. Prisco Pescitelli to start the session and give the floor then to the keynotes. So Prisco, the floor is yours.
Yes, thanks, Domenico. Many thanks for the organization of this conference, to all the key players and partners, NGOs that are organizing the meeting, and to the University of Catania, which is hosting the meeting. We are very glad as the Italian Society of Environmental Medicine to be part of this project and this conference on One Health approach declined in this session to the urban health, which is a very important part of the transition we are fostering in the perspective of the zero pollution strategy of the European Union and the so-called Green Deal triggered at the European level. We just heard about the importance of having nearby our cities and maybe also in the cities of green spaces with many plants that we are thinking that are very important part of the transition and urban health. As we know, European Union is committed and also European member states to the European forest strategy to plant a million trees in the next 10 years. However, one of the important things is to lower the emissions of our cities and make our cities healthier. As the European Environmental Agency publishes its annual reports on air quality in Europe, and one of the major contributors to the particulate matters and to the other pollutants that are affecting human health and generating 500,000 deaths per year associated to directly to the environmental pollution. A great part of these emissions are produced by our cities, by our heating systems, by the vehicular traffic of the cities, and all the activities connected to the urban life. So we could not cope with the transition in progress if we do not accept the challenge of transforming our cities. We have here with us this afternoon some special speakers, such as Carlos Dora, who has been committed with the United Nations at the World Health Organization to these topics, environmental health topics, and yesterday it was the Environmental Health Day, and now is the president of the International Society of Urban Health. So we will listen to his perspectives and suggestions and projects. At the same time, we have the honor to have with us Mark Nieuwenhuijsen, who is the director of the Institute of Global Health in Barcelona, and is the author of a very big study recently published, which has addressed specifically how many lives would be saved just if we had fostered the application of the air quality guidelines published in 2005 by the World Health Organization. And we know that last September, these WHO guidelines have been updated, and the thresholds, the limits for particulate matters and other pollutants have been even lowered. And we are now waiting for a new air quality directive to be set at the European level by the European Union, that we imagine would be very difficult to address and to approve. But we have to do our part as a civil society and scientific associations and NGOs. So I will start with Mark to give the floor to you, and thanks for being here with us from Barcelona, Mark.
Thanks so much, and it is a great pleasure to be here. I'm actually at the moment in a workshop in Hanover on nature and health. Unfortunately, I have to go back to the workshop. But before that, I would like to present you some of the work that we've been doing and other colleagues of mine have been doing around how to make cities healthier by improving urban and transport planning. As Prisco just told us, particular air pollution is a very big problem in cities, causes many deaths. We estimate more than 200,000 deaths in European cities. And also what we saw, particular cities in northern Italy, like Brescia, I mean, we're top of our list where many deaths occur each year because of the air pollution levels. We know that there is a relationship between urban design of a city, how people get around, how this leads to environmental exposures, and how this leads to morbidity and mortality. So if you design and invest in a study for cars, what we often see, we see that cities are car dominated. You get a lot of people using the car. That leads to air pollution, to high noise levels, to urban heat island effect because of the asphalt that's around, also to more stress, less social contacts and less physical activity. And that leads to disease and premature mortality. On the other side, if you invest and design cities for active transportation, say for cycling, you get more people to cycle, what leads to less air pollution, less noise. You don't need as much space in a way for them. So the space that you have at the moment for cars are used for cycling. You can put trees, so you get less urban heat island effects. Also, we know that cycling causes less stress, more social contacts, and more physical activity. So you get less disease and less premature mortality. We did an estimation of the current impact of urban and transport related exposures in Barcelona. And you know, as you know, in southern cities in southern Europe, I mean, they're very compact often, and they're very car dominated, or it seems to be at least. In Barcelona, only 1 out of 4 trips is actually by car. The rest of the people use public transport or active transportation, but because there are still so many cars around, it seems to be that the whole city is dominated by cars. We found that we could prevent each year almost 3,000 premature deaths in Barcelona if we would improve the current urban and transport planning related exposures in Barcelona. So if we could, you know, get people to do more physical activity as their daily commute, we could prevent almost 1,200 deaths per year. And if we would reduce the air pollution levels and noise pollution levels, that would for each prevent 600 deaths per year. On the other side, also, if you would reduce the heat island effects, particularly the extreme heats what we're getting, we could prevent 400 deaths a year. And if we could increase the green space to recommended levels, we could prevent over 100 deaths each year. So you can see that by changing urban and transport planning practices, you actually can prevent quite a lot of premature deaths. In this case, 20% of the total mortality that's actually occurring in Barcelona. So what are some of the solutions? What should we do? And I go through a few of them here at the moment, what I think are important. And the first one is to think about how can we implement new urban models in our current cities that could improve or could promote health that we're actually having. I recently wrote an article around this where I came up with 3 or 4 different new models that are being promoted or being implemented in European cities. The first one is the low traffic neighborhood in London, where they cut off the streets for cars or reduce the speed within the cars. The second model is the superblocks. The superblocks are being introduced in Barcelona. And I'll talk about them a little bit more in a second. The third one is the 15-minute city that has been implemented in Paris, where the idea is that everyone lives within 15 minutes of important destinations in their lives, like work, like school, like the shops, cultural events. So this is how, you know, how do you get destinations where people often go to? How do you get them closer to their residences or move the residences to them? Whereby we also reduce the use of cars and can activate or improve active transportation. And the fourth one is the kind of the car-free neighborhood. Car-free, and in this term we've got Vauban in Freiburg. This is a car-free neighborhood with sustainable housing, a lot of green space, a wonderful place to be around. So let's go a little bit more in detail in the Barcelona superblock. On the left side, you can see the current situation. This is where we have a grid system where the cars go left and right, up and down, you know, one-way streets. Lots of cars, lots of motorbikes as well. The idea of the superblock is to cut off 4 junctions in a block of 9, and the cars can't go in there anymore, but they need to go around it and use the inside of this block for active transportation like walking and cycling, and also for planting more green space. Now, the idea is that the original idea was that 500 superblocks are being implemented in Barcelona. Unfortunately, we're not so far yet, but we did a health impact assessment and estimated that we could prevent over 600 premature deaths each year in Barcelona if we would introduce the superblocks throughout the city. So this is one of the examples of a superblock that has been implemented. This is the superblock in Sant Antoni, where on the top you see the situation before, streets with cars going through, and at the bottom after the implementation of the superblocks, where you can see no cars anymore, more green space, and people walking around. Now this photo is taken in the afternoon, so it's a bit too hot for many people to walk, but you get the idea at least. So if you break down the more than 600 deaths that could be prevented, most of them come from the reduction in air pollution, because you get a reduction in air pollution because the car use is going to reduce in this area, and particularly nearby exposures, but also because of the reduction in noise, heat island effects, and because of the increase in green spaces. The physical activity here is underestimated because we only looked at changes in transport mode. If people didn't use the car, they go for cycling or walking or something. But there may be also benefits for people just walking around more in the area, what were not included. But you can see changing the urban design can actually prevent quite a lot of premature deaths each year in this case. The other thing is that some of these models are perhaps a bit more difficult to implement, but you know what has been implemented in some cities now is the so-called 30 kilometer per hour limit, what actually can reduce quite a lot of deaths, traffic injuries, but also, you know, makes the roads much calmer and much more pleasant for other road users as well, like cyclists. Unfortunately, in the cities that the 30 kilometers per hour have been implemented, it's not always been enforced. So you can still see that, you know, in these roads where there is this limit, that people still drive faster. And I believe that enforcement there is also very important. The solution often is brought as that the electric car is the solution to our problems in our cities, you know, because then the electric car doesn't produce air pollution, and it produces less noise in a way, and also less CO2 emissions. But don't forget that what the electric car is still a car, and it takes up a lot of space in our cities. As what I said, for example, in Barcelona, 1 out of 4 trips is by car, but the car takes up 60% of public space in our cities because the roads are public space. This space could be used in a much better way. I mean, imagine that you take the asphalt away and plant trees. That would be a much nicer environment for people to be in, of course. So we need to get away from cars in our cities, I believe, and move to active transportation. We know that many of the car trips, up to 50%, are actually less than 5 kilometers and could be easily replaced by other ways of transport. We know, for example, that cycling has many benefits. It reduces risk for premature mortality. It combines transport with going to the gym. A lot of people don't have time to go to the gym, but if you cycle to work, you get physical activity. Causes less air pollution, less noise, 0 CO2 emissions, takes up less space, and cyclists are generally much happier. We also know that the benefits of physical activity well outweigh the risk of more air pollution inhalation or accidents from cycling. This is one of my favorite cities for cycling. That's Utrecht. I mean, you see very few cars, but you can see lots of cyclists, and it gives a much better environment in Utrecht. We did a study where we looked at the relationship between the available cycling infrastructure in 167 cities in Europe and the mode share of cycling. And what we saw that there was almost a linear relationship between how much safe cycling infrastructure was available in the cities and the mode share of cycling, up to 25%, so 1 out of 4 trips. Over that, the relationship broke down. Probably other factors are important, but what you can see, or what I think is important, is that you need to provide safe cycling infrastructure for people, to get people to cycle in cities. And unfortunately, there are still cities that don't have enough cycling infrastructure, but hopefully more will be introduced. During the pandemic, the COVID pandemic, cities started to introduce more cycling infrastructure, and that we saw also an increase in the cycling mode share. We also estimated that in these particular cities, 167 cities, we could prevent almost over 10,000 premature deaths each year if the mode share would go to 25%. So kind of if we brought all the cities up to the 25% mode share of cycling. The other thing what we need to be thinking of is greening our cities in terms of bringing in more green space. Many cities lack green space in Europe. We know that greening cities has many health benefits, as we just heard, including a longer life expectancy, fewer mental health problems, better cognitive functioning in children and the elderly, better mood, healthier babies. Also, it helps mitigate air pollution, heat and noise levels. It helps a little bit towards CO2 sequestration, and replacing roads and parking with green environments can change an environment that is detrimental that's currently detrimental to health to something that is beneficial to health. We recently did a study where we looked at green space levels in 1,000 cities in Europe, including many Italian cities. And we found that over 60% of the population did not have sufficient access to green space as defined by the World Health Organization. The World Health Organization says that everyone, every resident should have a green space of at least 1 hectare within 300 meters. And many people or many residences didn't actually have this. Often what we see is that there is a lot of green space in the city, but it's on the outskirts of the city and not very close where people are. We also estimated that if we could bring the cities in this study up to the level that the WHO recommends, we could prevent 43,000 deaths each year in these cities because of the increase in green space. If you want to know the numbers for your city, go to our website, isglobalranking.org, where you can find specific estimates for green space, but also for air pollution and noise and health impacts in 1,000 cities in Europe. Of course, to change things, we need to have a multi-sectoral approach. I'm coming from a public health background. I can say what is good and bad for health, but I can't make the changes. So we need to work with urban planners. We need to work with transport planners. We need to work with the education sector, with architects, to actually promote working together and making the changes to make our cities better. Can we do it? Yes, I believe so. Look at this, Seoul and Korea. And they first had a motorway on the left, and they took the motorway down and put in nice green and blue space with a few smaller roads, a much nicer environment. This is the Alderley Hospital in Liverpool. Before they had the old hospital on the left side with a park. They asked the children, what do you want? They said, we want a bigger park. So they tore the old hospital down, built it in the park for... Sorry, they put it down where the park was underground, and they got a much better park. Here, there was Vauban in Freiburg, car-free area. And this is one of my favorite streets in Barcelona, Ramblas de Poblenou, where people can just walk around and enjoy a lot of green space. And I think this is what we should aim for in our cities, streets where people can walk and cycle and enjoy green space at the same time, live there, but also can go shopping, everything together, very nearby. I've written a few papers around this. If you want them, you can email me or you can just download them. And thank you so much. And I'm happy to take some questions if there's time.